of you.
Yeah, it hurts.
So, however, when you put these sketches I just did along with all of these symptoms you have, there's nothing that looks like CLIP fibro. That's it.
To you, it's very obvious.
A lot more than that.
Oh, I'm really lucky I'm not crying then. I could be really hurt.
Remember little girls, you were a goer. You look like you were athletic at one time.
Well, yeah, once upon a time.
Yeah. Anyhow, the more athletic people obviously have a higher pain threshold. Wins will go up.
I think I'm a major win. I am surprised. Okay.
I do not think you are. That's been going in there for quite a while. I think your guess for the probably 12, 14 years, maybe when the first started with the neck.
12 or 14 years old?
No.
Or years ago?
Probably 95. When the hives appeared, the next 6 months and 18. That's usually
just kind of slowly
started getting. Yep. All right, I'm going to have a non-mint, and that's significant. I've been talking all day long, and I want to move the patient.
Okay, that's fine. A non-mint.
You'll know why a non-mint pretty soon.
Right.
I know, I read your notes. Michael tablet.
No, you don't want anything. You just want to spin around on the front.
Yeah. Oh, we're not done?
Sing.
Take my notes. But I do have my tape, so I don't know what that word is. You already have it.
But I think it'll watch. So you ready? Get her on paper towels.
Okay.
The ink sinks in. Gets on my cuffs. Wife at home. Okay?
We do not want her to slip.
All right. Anyhow, we started 47 years ago. We had a man with gout. And taking his medication could suddenly strip tartar off his teeth with his fingernail. The mineral of tartar is calcium phosphate. And of course, I'm an endocrinologist, so we do chemistry stuff.
Mm-hmm.
But we soon realized we had a weird disease in our hands. They had no name in those days. Also, that calcium was not the bad guy. We could add all the calcium we wanted. Everything keeps pointing to an inherited problem with the metabolism of phosphate. So the world is looking for something else. But we know phosphates are 80-90% absorbed from our foods. You can't avoid it. It's in everything we eat. But we depend entirely on the kidneys to unload the excess. And there's an area of the kidneys that should be doing that for us.
Unloading the excess phosphate?
Excess phosphate. Obviously, one of the
it's holding on to it?
Mm-hmm.
Oh, it's building up.
So one of the genetic defects should show up right there. So here's what we think happens. As years go on, beginning at birth, is this minuscule retention of phosphate. The bones are very adept at soaking that stuff up. So they will absorb, but only to the best of your genetic ability. And at some point when they just can't soak in anymore, perforce, the phosphates would try to rise in the bloodstream. But they're not allowed to go to an abnormal, measurable level. They're reciprocals to calcium. Raises, I've got to drop that. They go opposite directions. However, the 4 parathyroid glands in the neck guard that calcium level and won't let it waver. So the poor phosphates can't escape in the urine. They're not allowed to rise in the blood.
I did get that part. You know, you lost me 2 minutes ago, but I did get the it can't escape part.
Yeah.
Okay.
So therefore, the body has no choice. It's going to dump it.
So are you telling me this is genetic?
Yes, it is.
So you tell me I told you.
You're hormone. You've been maligned probably all these years. So all of a sudden you make these deposits. But phosphates carry 2 negative electrical charges, so they have to pull the positive charges of calcium with it, just to keep us electrically neutral. Net effect, we end up with an excess of both of those.
An excess? Excess of calcium?
And phosphate.
Okay, so the blood test I just did, it says you're 40% low on calcium. So he gave me powdered calcium. Should I be taking it?
Doesn't matter. Calcium not the bad guy. So,
oh, okay.
so anyhow, you get deposits of both of those.
Okay.
Depending upon where your body's going to get hit. Excess phosphate in those mitochondria we just talked about, well known in physiology, blocks the formation of energy. Calcium says, I really don't care, keep going. You'll end up with these schizophrenic looking things. There's not enough energy in your system to purge the simple metabolic debris of being alive. And this map would look the same at 2 or 3 o'clock in the morning. These are all spastic things I've drawn in. Well, there's only one mechanism for such sustained spasm, and that's calcium in the wrong place. So for me to do this, I've got to be able to move calcium in and out of the cell that rapidly.
Can I do that? Can I get better and do it? Or my body does it on its own? Getting this calcium to move around my body.
What are you going to do? This is what I do. We're in this together. You know? Your body obviously can't do it alone.
I know, but I mean, is there an exercise you should be doing every day to make it get to my toe and, you know, my shoulder blade and...
Exercise will make you hurt more?
I know.
Oh, okay. So there's only one mechanism for this. That's the calcium in the rubber plates.
Okay.
But the calcium needs a chemical pump to kick it out. For me to do this, I've got to be able to move calcium in and out that quickly. Now,
like a fish
the pump
tank.
needs energy.
Okay.
So here's a scenario. Excess phosphate blocks the formation of energy. You can't man the pumps to kick the calcium out. So you sit there night and day, spastic, wearing out and tired all the time.
I feel like a fish tank that needs a pump. The way that you're, that's my layman's term of your technical explanation. Okay.
I like mine better.
I know, I do too.
But then after you make, when the funny stuff is rising in the bloodstream, this thing gets worse. The brain is very vulnerable.
Yes, I cannot think.
People get tired, nervous, tense, irritable, apathetic, listless, poor memory, concentration, depression, insomnia, and anxiety. And all of a sudden you make this deposits of aches and stiffness come in. But as the blood is getting cleaned out, the brain's delighted to let that go. Everything snuggles in.
Oh, okay, we're going to clean it out with your magic. Your magic
back off,
tea.
back off. So all of a sudden you feel fine.
Okay.
Until you build up enough, there it comes again.
Oh, no, this is going to come in waves?
The beast is the cycle. You've already seen it the last 12 years or so. So you're doing this kind of a thing, but progressively leaving behind more and more debris all the time until finally, looks like about 14 months ago, you're pushed over the line. Once you're over your pain threshold, and they simply cycle from bad to worse, you see there are no perfect days. 25, 30 years of this, we begin to see the first damage of fibromyalgia. That's when...
Osteoporosis?
Osteoarthritis.
Oh, okay.
That's when this stuff crystallizes in joints. And in the older age group, we see these sequential progressions of osteoarthritis.
So what happens with osteoarthritis in 20 or 30 more years? Am I going to need a wheelchair?
No.
That's why you're here now.
Why were you here?
I'm just wondering. You said it gets bad from worse to bad or bad to worse. Okay.
Okay, about 15 years ago, we realized why tennis didn't work. I had the 4 old gout pills. They worked fine. I took one for 30 years, told me it cleaned me out. But they each had potential side effects. This stupid stuff does. It's a Robitussin cough syrup, cold preparations. Its only purpose on the market is to loosen phlegm. So they made these 600 milligram tablets 30, 35 years ago for people with asthma and bronchitis and cold and so on. That turned out to be our most powerful medication.
Can I take that instead of Sudafed if I'm going to stop my Sudafed? Because I'm going to want my Sudafed, and your thing says don't take Sudafed, right?
You just left the scene. You better come back to the scene of the crime, though. You're not done yet.
I know.
You can't ask anything else like this.
Okay. I wanted to follow along because I wrote it early. I'm following.
Yes, that was early. You're on track.
I wanted to follow along. You're right here, and I'm right here, and I just wanted
So what
to...
life medicine does?
Okay. See?
It tells the kidneys to eliminate something. I measured this coming out. That seems to happen at least 6 times faster than we put it in. So the way the kidneys work, it's like opening a faucet. So as the stuff is pouring out in the urine, it siphons it out of the bloodstream. Whatever it is appears to drop down to normal very quickly within 24 hours.
Good.
Here's our target. If you have a joint, muscle, tendon, ligament, brain, intestine, whatever loaded with stuff, as blood level drops, the body demands chemical balance. So if I can lower this compartment, it's a bit like letting water run downhill. Now we're free to begin pulling the stuff out of the tissues, back into the bloodstream. The difference is with the medication, now we can wash it out in the urine the way you were supposed to in the first place. It's a simple reversal. But there's a hitch with that.
Oh, it's a simple reversal. Okay, because I actually had questions about the reversal. See, during reversal, symptoms are usually intensified, blah, blah, blah. I know I'm ahead of you.